President Daniels, to you, to Mike Bloomberg, and certainly to the folks who helped put together this public healthcare initiative. Thank you very much for the invitation. But real thanks goes out to those of you who were out there. If you were at all involved over these last 4+ years in the effort to save lives, whether you were the researcher who helped us develop the life-saving treatments, whether you were the network organizer who made sure we reached people in places that often are left behind, or whether you are the people who continue to run our public health network, thank you for what you have done. You did, and you are saving lives. I mean, literally, you are saving lives. If there are any folks here from community health centers, the federally qualified community health centers, you saved lives. If you work in a pharmacy, you saved lives. If you worked on the vaccines that saved millions of people, you know you saved lives. And so to each and every one of you, thank you. And to those of you who are students who are hoping to get to save lives, science doesn't change. Politics might, but science doesn't. And so my sense is you will go forward with that tried and true process that we use in science for health, which is your North Star is evidence. Evidence based on research and evidence based on practice, not on politics. And so I say to you, don't stop. Keep going. Be as intentional today as you were when you decided to go into this field. And you will make a difference and you will save lives. So today in America, there are more Americans who have a chance to go to a doctor or to visit a hospital and leave their child there and not worry about going bankrupt. More people in America today can do that than ever in the history of the United States. More than 300 million Americans today have their own health insurance, whether it's private or whether it's public, but they have their own health insurance, which means they can walk into a doctor's office without bowing their head. They can leave their child in that hospital without worrying whether they'll be able to pay the mortgage or the rent because they come with coverage. That has never happened in this country before. Today in America, we are inventing the next generation of medicines and vaccines that will continue to save lives. Today in America, we're developing some of the best ways to move our country's health system from one that treats illness to one that promotes wellness. But I could tell you a different story if you want to go back with me. Just let me take you back a few years. Because today, if it were 4 years ago, would have been COVID ravishing our country. Americans losing their jobs. Americans losing their health care. Many of you may have been among those. The day President Biden took office, January 21st, 2021, we got hit. We got hit by 9/11 3 times on one day. That was the severity of the crisis of COVID, that more than 4,000 Americans perished the day President Biden took the reins from the previous administration. That was where we were some 4 years ago. And it's so easy today, when none of you are having to wear masks, when none of us are worrying about socializing together, that was where we were. And our path was getting worse because the plane was descending rapidly, out of control. And so it is fascinating to see where we are and to remember where we were. But remember that we are where we are today because of the work that you all did, which was based, as I said, on that research, on that practice, not on the politics. And so today we have an opportunity. We should treat today the way we treated 4 years ago, at least under President Biden's watch. a break glass moment when it was time to do things differently. And the result was we offered to Americans a life-saving treatment, a vaccine that became available to everyone, not some of us, not based on your income, not based on your zip code, not based on your status, every one of us. And the result was we moved forward. The result was everyone had a chance to get a vaccine. 270 million shots in arms to date have gone. But the bigger and more important element of that fact is that not a one of you had to pay a single penny to get that vaccine. That's what breaking glass means. That's what it means to move forward. That's what it means to not let disparities in America get in the way of getting a shot in the arm of everyone, whether you're black, brown, white, Asian, Native American. You can do that kind of stuff. And so what I think it's important to understand is we are at a fork in the road, and we have to decide where we go. And let me tell you how I think we get there the best way possible. Once you break the glass, be intentional. It was not luck that under President Biden's watch, 270 million vaccines have gone into the arms of Americans. It was not coincidence that today there are more Americans who have health insurance coverage than ever before. And it is not easy to get those types of historic numbers into the records of America. It is intentional. And we must all make sure we are intentional as we move forward. To make sure we can move forward with everyone with us, because there aren't a lot of folks with us today, whether it's on vaccination, whether it's on the need for a more national public health system, because we don't have a national public health system. We have a nationwide system of public health based on 50 different states doing it their own way. But if we do this intentionally, we can have results that take us from 4,000 Americans losing their lives in one day to being able to say that we are moving forward together. And so I will close by mentioning what I learned very well by one of the greatest minds I've ever seen, my daughter's piano teacher. Carl Mathis, a wonderful pianist, used to tell my daughters, please make sure you go home and you practice your pieces. Now, when you practice your pieces, practice them right. Because practice doesn't make perfect. Practice makes permanent. How you practice will determine how you play. We need to practice right when it comes to healthcare. We need to make sure our research is founded on science and evidence. And we need to make sure our practice is guided by that evidence. And we keep that North Star. If we do that, we will once again pull out of any crisis that we face. We will once again change those statistics. We will once again prove that we are ready to lead. But if we do that, it will be because you, the researchers, the healthcare advocates, the healthcare professionals, are the ones that remember your North Star and never let politics get in your way. I have been thrilled for 4 years to have a chance to watch some real professionals do their work in healthcare, and we have made a difference. But it was not an accident. It was not coincidental. It was totally intentional. Let's be intentional. We'll get some things done. Thank you very much.